your homes to speak to you about the state of our common battle against the pandemic of the coronavirus that is affecting all parts of the world, including our own. Exactly a week ago, I announced the lifting of restrictions on movement of persons resident in Accra, Kumasi, Tema, and Kaswa. I did so on the basis of the data and science, as well as on a careful analysis of the impact of the restrictions on several sectors of our population, especially our informal workers, who need to have a day out in order to provide for themselves and their families, the poor and the vulnerable. Since I last spoke to you, we have completed the analysis of another 32,031 samples, bringing the number of tests from 68,591 to 100,622. From this pool, the total number of confirmed infections has gone up from 1,042 to 1,550. Our recoveries are now 155 and deaths 11. The 2 new cases of death, like the other 9, are all of persons with underlying health issues, what the doctors call comorbidity. The positivity rate, i.e. the rate of infection from those sampled, continues to remain constant at 1.5%. 6 persons are critically ill, and the remaining 1,378 have mild or no symptoms at all and are responding to treatment. Of the 508 new confirmed cases, 465 are from the Greater Accra metropolitan area, 10 from Kaswa and the Central region, 7 from the Ashanti region, 6 in the Eastern region, 2 in the Northern region, 1 in Western North, and 17 from the Oti region. These 17 were the result of interceptions near Nkwanta by officers of the Immigration Service and other security personnel of 2 cargo vehicles that had on board a total of 67 passengers who were illegally entering the region from Accra during the period of the lockdown, and all of whom were tested, with 17 proving positive. We are still very much in uncharted territory, and clearly we still have some way to go towards ridding ourselves of the virus. The truth is that this will be a long war, broken up into several battles. Indeed, we registered a modest success in the important battle to trace and test many of the persons who had come into contact with infected persons, and we cannot and will not rest on our laurels. We will not let our guard down as the fight against this virus has to progress. We will pursue vigorously our strategy of enhanced 3 T's, i.e. tracing and testing to allow us to identify infected persons and isolating and treating them. It is the surest way to root out the virus. Our efforts will remain constant, as will our abiding faith in the Almighty and our determination to defeat the virus. We must continue to be grateful to members of the media, members of our security forces, and our health workers for their sacrifice and high sense of patriotism in their contribution to the fight against the virus. The health workers who are working day and night to care for the stricken must continually be in our prayers. Their efforts will be in vain if we at home do not support them. In addition to the incentive package given to all health workers, government has enabled domestic production and supply of protective equipment to our health workers to increase significantly. They have received in recent days 905,031 nose masks, 31,630 medical scrubs, 31,472 gowns, 46,870 head covers, and 83,595 face masks. We're also grateful for yesterday's gift of medical supplies from the government of the United States of America to help boost our testing capacity. The latest assistance we have received from a friendly foreign nation. So let us, on our part, continue to protect further our health workers by practicing social distancing, washing our hands with soap under running water, refraining from shaking hands, and yes, wearing our masks whenever we leave our homes. I'm happy to note that the hard-working Minister for Health, the Honorable Akufo-Addo, Member of Parliament for Doma Central, has, as of yesterday, the 25th of April 2020, issued directives to guide the production and mandatory wearing of face masks. We should all familiarize ourselves with them and apply them as the regional coordinating councils of the Greater Accra, Ashanti, and Central regions are demanding of their residents. Together, all these protocols will prove effective in helping each one of us to avoid contracting the virus. The doctors and scientists tell us that the virus is transmitted from human contact, talking, singing, coughing, sneezing, and thereby sending droplets of the virus from one person to another. That is why each one of us must strictly adhere to these directives. Fellow Ghanaians, in the course of this past week, I engaged a number of stakeholders to discuss the future of existing measures which have imposed restrictions on public gatherings, shut down our schools, and closed our borders. I met with the chairperson and members of the Council of State, the president and members of the Standing Committee of the National House of Chiefs, representatives of organized labor, that is the leadership of the Trades Union Congress, the leadership of the Christian community, the leadership of the Muslim community, the president and executive committee of the Ghana Medical Association, representatives and leaders of the media, and the leadership of the National Union of Ghana Students, NUCS, and its affiliated associations. The strong consensus that emerged from these and other consultations is that the existing measures must be maintained for now until we have a firm grip on the movement of the virus. This consensus is supported by data and science, and I'm also very much of this view. I have accordingly, by executive instrument, extended for another 2 weeks the suspension of all public and social gatherings, as set out in Executive Instrument number 64 of 15th March 2020, effective tomorrow, 1 a.m., Monday, the 27th of April. I'm encouraged that so many of our trotros, taxis, and buses are operating with a minimal number of passengers, and our businesses and supermarkets are enforcing the need for social distancing, the use of hand sanitizers, and the wearing of masks for all patrons and staff. I want to single out supermarkets such as Melcom, Palace, and ShopRite in particular for the excellent discipline they are maintaining in their enterprises across the country, and call upon all other enterprises, especially our market women, to emulate them. The example of markets in the Sekondi Takoradi metropolis, where social distancing is being well observed, is an excellent one for market women all over the country. I am fully aware of the sacrifices in reduced revenues that all businesses and enterprises are suffering. But I believe we have no option but to sacrifice to defeat this virus. This is the time for sacrifice so that we do not have to bear a greater cost in the future. Unhappily, there continues to be the worrying news of a few Ghanaians aiding some West African nationals to enter our country illegally, despite the closure of our borders. Even more disturbing is the fact that several of the West Africans who have been arrested have later tested positive for the virus. These are unpatriotic acts and must stop. We cannot allow a few persons who are motivated by their own selfish money-making interests to endanger the lives of the rest of the population. Not only will persons who enter our country illegally be strictly dealt with, but so will Ghanaians who facilitate their entry. As I have said before, being a Ghanaian must mean that we look out for each other. Just as the virus has disrupted our daily lives, it has also exposed the deficiencies of our healthcare system because of years of underinvestment and neglect. Whilst maternal, newborn, adolescent health and nutrition remain our top priorities, we must pay increased attention to chronic non-communicable diseases such as heart diseases, diabetes, and asthma, which have proved to be the common risk factors for the 11 deaths we have recorded from the virus. It has highlighted the need to address mental health issues and the crucial role of emergency services to which the new fleet of ambulances and drones are responding. We must emphasize preventive and promotive aspects of health in addition to care for the sick. The virus has also revealed the unequal distribution of health facilities, as we have tended to focus our infrastructure on Accra and one or two of our other big cities. But as we've seen, epidemics and pandemics, when they emerge, can spread to any part of our country. There are 88 districts in our country without district hospitals. We have 6 new regions without regional hospitals. We do not have infectious disease control centers dotted across the country. And we do not have enough testing and isolation centers for diseases like COVID-19. We must do something urgently about this. That is why government has decided to undertake a major investment in our healthcare infrastructure, the largest in our history. We will this year begin constructing 88 hospitals in the districts without hospitals. It will mean 10 in Ashanti, 9 in Volta, 9 in Central, 8 in Eastern, 7 in Greater Accra, 7 in Upper East, 5 in Northern, 5 in Oti, 5 in Upper West, 5 in Bono, 4 in Western North, 4 in Western, 3 in Ahafo, 3 in Savannah, 2 in Bono East, and 2 in Northeast regions. Each of them will be a quality, standard design 100-bed hospital with accommodation for doctors, nurses, and other health workers. And the intention is to complete them within a year. We have also put in place plans for the construction of 6 new regional hospitals in the 6 new regions, and the rehabilitation of Efiankwanta Hospital in Sekondi, which is the regional hospital of the Western region. We're going to beef up our existing laboratories and establish new ones across every region for testing. We will establish 3 infectious disease control centers for each of the zones of our country, that is the coastal, middle belt, and northern, with the overall objective of setting up a Ghana Center for Disease Control. The recent tragic CSM outbreak, with over 40 deaths, has reaffirmed the need for ready access to such infectious disease control centers, even though in our time, nobody should die of the disease. early reporting is what is required, and I implore everybody to heed this call. We shall make these investments in our healthcare system not because it is going to be easy, but because it is self-evidently necessary to serve the needs of 21st century Ghana. The three development authorities, the Zongo Development Fund, and the Metropolitan, Municipal, and District Assemblies will be tasked to place health infrastructure amongst their highest priorities in the coming years. Soon, at the appropriate time, the exact volume of investment required will be duly and transparently laid out for public scrutiny and action. It is obvious that side by side with the investment in the physical infrastructure of our public health system, we will have to intensify our policies for the growth of our domestic pharmaceutical industry so that we can generate our own medicines and medical supplies and products, which should no longer be dependent on foreign imports. Further, the National Health Insurance Scheme is currently in a stronger position as a result of the significant reduction in our standing arrears. It is my hope and expectation that this expanded and empowered public health system will be the most enduring legacy of the pandemic. Universal health coverage in Ghana will then become real and meaningful, for every Ghanaian deserves good health and good health care. Fellow Ghanaians, just as the Christian celebration of Easter was severely affected by the virus, resulting in the cancellation of the usual activities associated with Easter, the holy month of Ramadan has not been spared either. It is my understanding that in the time of the Prophet Muhammad, sallallahu alayhi wasallam, any time there was heavy rain, he admonished the faithful through the azan to stay in their houses and pray rather than going to the mosques. In Bukhari's collection of the Hadith, Book 13, Hadith number 24, Ibn Sirin reports that Ibn Abbas said to his muezzin, and I quote, "After saying, 'I testify that Muhammad is Allah's messenger,' do not say, 'Come for the prayer,' but say, 'Pray in your houses.' It was done by one much better than I, that is, the Prophet." Through analogical deduction, Muslim scholars agree that rain represented danger, and therefore the prescription for Muslims to stay at home and pray in times of heavy rain is applicable to all life-threatening situations. I thus call on all Muslims to heed this prophetic admonishment, to pray at home, so we can protect ourselves from the danger of COVID-19. This is in line with the counsel of the wise, devout Muslim scholar, the Chief Imam, Sheikh Dr. Usman Nuhu Sharabutu. I wish all Muslims Ramadan Mubarak. In this period, let me state once again that the virus is the enemy and not one another. We must be resolute in our unity to defeat this invisible enemy. No country on earth has been spared the ravages of this virus, and my single-minded goal is how to steer the country out of this crisis, protect our population from the virus, and see to the rebuilding of our economy. Nothing else matters for me. Fellow Ghanaians, we must now begin to lift our heads above the parapet and look at our future with courage and hope. I shall be outlining shortly the path for bringing the restrictive measures systematically to an end and defining the basket of measures for the revival and growth of our national economy. We have to own our future. I'm truly proud and indeed humbled to stand here today as your president, witnessing the unfettered assistance Ghanaians have given to each other, the help you have offered to those in need, the generosity of your contributions to the COVID-19 National Trust Fund, and the support and understanding you have given to the difficult measures government has had to undertake. It is said that out of adversity comes opportunity, and through this ordeal, we Ghanaians have had the opportunity to reintroduce ourselves to one another, showing the best of who we are. The solidarity and humanity on display in these past days fills me with even more optimism that Ghana will overcome this crisis and come out even stronger and more resilient. Enuanom, nse ni abe ahaye nyina. Nenso me ware hihye mu se Onyankopon adaroma. Nsema maken si enye no ayeye no ye koso disua eno ene beboa yen. Obi ahohoro ne nsa. Obi andi ni huni. Ye pia yanhya mask no. Ye wa abonten a ye makwan enda yentem. Ye masede sa sembi ba esese me na me bɔ mo ho ban. Momboa me na mentumi nya madwuma. Na Nyankopɔn bɛboa ama yɛfi ɔhaw eyimu. Anyame me ile akesi no ne bane egba wo fe na. Si ye hemo ka yeli akanyumodromo na. Ni bi ni nke ake wo fe ni wo fe ka wo ye no. No ni ba wa wo fe. Wo fe mo afoede. Ni ekwa hejuba. Ka wo jepo e.
Omaneshe no watwe abo apaho sema aduno emiensa UTV so enie brason se de taye no so mapani ba bekasa bia okasa wia na ne sema ode etu dwan sanse na ye brofunti no na yeso ye de abaya kan kasa yi mo na ama omanfo so ate ase na wotwetwa mu no ye de bra mu ne so yasa atena sibiwa na dwi so ye de omapani ekan ne nyina no ye de nyina de bra mu enne anadwi kwabdanchi wo si akon enie mini aba obahima efiache sidu na ne yaji nkunya a it is a insemi of abo nyina ye de bra mu ana ma me makwa aba
ye ni akobi
boko de
Akufo-Addo na so
nyame adom boko omapani akasa
wakasa pa
semafo ayekado mu 80 de omapani ekan no Mashase na edi atuja krakra de ma omafo no bia ate ase raso a ewo ebra emu edi mu nti eyetu ho ache na ewo se yina yenya na de omapani na mo oturi ni pedifo nyina no yeso eta eche bia na etimi aboaye na yetimi ade ho de efri eye COVID-19 no ensoso emum yeshase omapani echia Ghana fo gina busaye se nyame adom nse gina ho ye no chese wasa aba yefi mu ebio se de wo ye no na nyina no ejina eye COVID-19 ye nti na obaye enumu na wo chese na wotwie na wotwe pepenie na oba abonten ede betu dwa a wo chese o hye a wo de etu ye so se omanfo entena fie nyina no sisi de nyame adom wayi ede fe eye enkra ha Kumase tema ena afisu so kaswa na ye wo yi free ho no na nyina ejina data ewo ena afisu abodi mu nyansape wo mo so hwehwemu a wo mo so eye ena ejina so a ema eno so eba no esi ya ema amanfo so enya kwan na omunyuma so ahodo no wo so ekoye eno ena ema pani ede etu edwabio a wo chese na wotwetwa mu oba ebekasa ede ekireye no enumu ena na wo chese na okira 32,031 samples ena na ewo na say e kan nyina ede ebomu a na test ahodo so a yetimi eye no na eno so no 68,591 eno ena wochiremu esem wo hwesa cases ahodo ya na ode eba nyina na test awodo koye ni emu nsem nyina my case no ekugina 1042 eno na wo chese ne test awodo ayaye ede aka ho bi no ama e number ne ehuri e de ekosoro eno akoye 1550 a wo chiremu a enipa be 155 na omoso nyame adom omoso eho ato womo afi enipa edu ebaako na womo so womo ahwere womo enkwa na eye sa two new cases a eye enipa womo ahwere womo enkwa ababeka ho no ene mapani ede etu igwa a wo chese ni nyina no egina eye yare kakra bi a saafo na womo ewo eno na enam so bi e ka ho a ema womo nam so mo so ehwere womo enkwa no oto aso ede etu gwa wo chese emu ensia de womo afie pa wo yare no so emu edene na wo chese emu 1378 womo so die na se womo yare no ase ewo kakra ase eni ho a chese ja womo gusu a womo eje arehwe eno na emapani ebu nkunta na edi abafom no wochemu ese enkramante mu ankwa no na wochese cases aye wono 508 na se ni na okaka zinya de bomo 508 de ba enkramante mu ase no dia na echese enipa womo enye bi no 465 ewo akra ha afesu so emu edu esu Africa so eno ewo mfifi mantemu emu enso esu efri eye asante mantemu emu ensia esu efri epoye mantemu emu mienu efri tivido mantemu emu baako esu efri western north and emu edu enso 17 esu efri oti region eno ena wo cheche mu dia tudwa wo chese 17 na yeka ho asemi no na wo chese enkwanta immigration officers no ena mo bo adwuma na emu edene pa isan se na cargo cars mienu ena enipa be eduosia enso na wo mo ewu mu enti ekogina so a epedifo ne ehu car no ikufiri safo yina no na echese emu edu enso de na ese yare no mo bi na so mo ye positive a eno ejina so ema figure no eso eba abontin sei na
Yatwa ensema omampanyi ekaye no eso na omampanyi to aso ka sesa wo hye eko aye ko na enye bayire abrewaju eden papa enne nye nne ana ochena ena eko na besi eto mu tenten aye ko pa enti omanfo nyina emmoa na eko ne yentumi ni nkonem na omampanyi kasa no se oman Ghana ye ntentena ena ye nwudwu yabodwisem ye nhome ye ni abre ye beko a ekopim se virus ni bedi ne so enkunem na wo ka no wo chese se wo hwe strategy ananse ya abani de egu akwan so a emu bi any tracing si ye hwehwe obi a wonya yare ebi ananse o virus ni bi ni ye hwehwe na a quarantine wo baby ni ama no enuro na pom dimpanyimfo ni ekono ho eno eye okwan papa akon a ye di so papa ena brekro na so ye testing nkofo ehwe ye gusu a de ache ade sen apom dimpanyimfo gusu a wo edi djuma no no so ogidie sesa akonya ye nam so yi onyankopon betai echi se oman am yetumi edi nkunim pa na omampanyi eto so se wode abasobode ma de ubofo mo boadwuma papa afi bambofo mo mamu nyina omamanyi ko mo ye adwuma eno so ti koda apom di nwumaifo se de motum ho asi wa mo ye adwuma die ene fe papa wo se we eche se ampa ye da kwasafo sunsum ede se oman bapa ede kire oman ebra yewo ahoyehi a etise emo nemum osema yere mfi se yenua no mo ye apomdin maifo a wo mutimi hwe wo mpo manya covid bi ye betumi akai wo mo ewo empaibo emo omampanyi keka no se nani abre woni apomdin maifo no wo mu edi nhihye pa bi egu akwan so enti di aban no ye ne se eniema ede boban no wo behwa mea ye bi wo man ya emo ne ede atai apomdin maifo no chi enti nansen yen obetumi aka se nox mask ede hwehye ye hwene no ebese 905,031 mako ena wode ama apomdin my phone enyina eno so tikoda medical scraps bese 31,630 ena no so wode ama apomdin my phone afenso 46,870 head covers niam mo de be chichichi wo muti no eno so akọ ede ama omema apomdin my phone ena 83,500 face masks don be chichi omenim so wode epi wo eso no se eno be boa papa no mampanyi si ye nani agye anura ya yenkosha America fo abaye yadoye PPE si omo de bia be pie so a ye be boa papa ne niema o mbetum de aye testing ahwe so obi wa yare ni bia na so se oni bie enti ni nyina emu no woka se sa aban ne ye na fam de na apom di nyuma ifon so ye afam de media ye ne de bambofo ye omo de dia wa utifi wasade ne sei wasade ne se muntiti mumu social distancing enipa mbom pe so emfa ansa nkoto obi kom enkochia no na afa so kra no se bre bia ye nhwe se ye di ensuo ne samna ebe hohoro ye nsa enkochia che obi nsem asemasi mi hu wa che ma me 5 bam debi sabe de ye bre ani braba wuntumi enye sa bio ene bre bia wo se hwe se unoxmas no obetumi ahye na wo de abo ho ban ebre bia wo pie afifie omampanyin se na pomodin so afo onrabo kwaku agema men wo ye mrahye bedwani e de madoma central adehye wo bona baso papa esan se enura ya na onrabo agina ne nan so e de nhihye bia gu akwan so wo hwe se obia onyitwi nyadoa obia ebehye face mask ebe na etumi aboa eno no wo se regional coordinating councils nso a ewo enkran eni emfimfim mantamu nyina wo ma yade omo bo adwuma esan se wo mo hwe se adehye no ebetumi di face mask no edijuma
na yetoa ensem no esomapeni esa edi etudwa awo chem se yare ya na se virus ya yeka ho asem no adokutafo enafe so abode mu nyansapefo edi atu edwa a omo eche se ekwan efa so a eba no enam se nipa anase nipa ehia ekwan efa so a ye kasa no so wan hwe ni na montman de temontaba betimi aba afi se wo to nwom no so no eno so enam so ba na betimi aba se obi ebowa na wo bo wono fa ne sa enkata da no eno so eka ho ebi se obi etiye ne ya na eja wo himsa eno so wa mo no ban ya eno so no ebetimi aba erinti ehu ebehia se enhyeyiri nyina no ewo sa etimi ediso na etimi eboa na etimi ma yede ho efi yare no emu eno achibio no na wo chiremu ese Ganafo na otwa etwa emu no meni epanifo bibire ehia de nyina no ejina eye COVID-19 nti epanifo kro enko agina eno nti na ejina so a meni epanifo awodo ehia ye meni Council of State for ehia ye afi so Labor Unions epanifo meni omu hia TUC for afi nyamsumfe kwa awodo no meni omu ehia ye Muslimi for meni omu ehia ye na afi Ghana Medical Association so meni wo mo ehia ye eni empanifo awodo bi na afi so encentrofo eka ho bi afi so omamu adesuafo nkamuko so meni omu nyina ehia ye ejeje adwenkyere ena omo toato adwene ebebre enu mu no ena wo kyiremu ese wo masem nyina ene se enhye ya ede eto hodom nom yesanyire mu pa pampe se owe achi na etimi emwa ye enu ti ogina eye amamra no so tumi kase ede ahye ne nsa so ede etudwa wo kyese na me eye adoma adwadai donko pepepe na echese wo kyiremu a public and social gathering nyina ne se ye hye mu bibrie no ensore bia ba ne sa miamia hodo a ye ni ade nyina no wasan ede na wo twemie no esa edi episo se eno so yetimi enye omanfo enhye ne so hone de o se ma ingikomu ye kwa asore ye hyehye mu bebredi gina no omanpeni che so ne nipanifo tena se no wo mu ehun se e se emiemu kakra sa de ka ho tomanfo enfoduku fa mo yem na wo twemienu pepepepepe na eno so ye de episo ede amaye eteno so asomanpeni ede atu edwa wo honom wo sa to so ede tudwa a wo chemu se trotro for taxi for bus for de gina no wonya ne entie se wo so ede hyehyeye eye adwuma se de aka se hwe no bi a fofa nipa amfo so no womo so eguso a womo eye ne se no achi no hand sanitizers womo eye bi social distance no womo eye no smart na ade nyina no womo so eye bi afi so supermarket ni ade a womo so eye adwuma ni ankokoma bi adwuma no eno so nya ne tie se max no enkofo ehye womo to bi so edimo staff no nyina eno so eboy papa eno na wo che se makomfo eno supermarket kese pa wo Ghana ha Palace mo na afi so Shoprite womo edie omampeni eche se wo bo mo abaso papa anya adekumade nyina ha ene se wura eye wo mo bebe omu di omudwa se de wasi ato mbo ase ede ehyehyeye ede egu honom efe keke akono papa eni ti we di omampeni echira wo se ede abasobom ede ema wo mo wo sa ato aso ede etudwa awuchemu se wudu ade che eye secondary takrade so a eche se edwa na ho no so no se de omo so esiye social distancing no efe pa omo ato omo sateti omo ntem kama ready for me ye guy papa omo ani atepa eno na wo sa che se ompani so ya awe se de amafo anya etuhu ache de ewa ewom se edwadie enhyeda enkoso eti toda na amasika se mai basa enso revenues na de yina no amafo eboa eye ne fe pa na yina ne se eni de waka enesem ye nyina ye moa ne ntu ye ho enfa enche esanse etu ho che ne betimi abo ye nyina enya de ebrewe eye bra e wo se de no ma edi agro nti no safo nyina so etu ho cha ebetimi aboa
yet also ewo nsem a omampanyi ede ato Ghana for anim no eso na de omampanyi e ka no ka se ne raho had your cousin in Yaja no bow. Said Ghana for one casabi. Etumi eboa pa eboa ema nipa bi omo ya hoho etumi yekude bewura omemo sa abre ya menu mienu nyina ye nitua se ye borders ya tum na che se wo boa pa e de hoho bi fakuntuna se e bewura omemo a na wa anye oman bapa ose enye kra enye subanpa wa nne subanpa di kra wa unim se oyesa emoa enso wo ye na wo ka no si otumre wa kiresie unim Safo na Ghana fo bi ankasa edi omanim edi omofa esumase kude nom de omo bewura o my Ghana ha no ye bekombekom ye bechi wo ma ye beso o ma hwe no wo mu nekita virus no enti wo boa yen anaso se o mboa yen enti o mampanyi se wo ye akon wonim se oye bia jai na wanya ya ye bechi ohowo ko na wode ne baaye no wan kasa so ye bechiw ama emra ene wadi se de esepepepepepe na so ye Ghana ni dia fiuyam na boa wo ho na boa oman no ene afoforo nyina na nyese enhihye ya aba ne de gu nyina echi no wo de obeye ho te se asodora chie na wabusu no waye de ope no wo hwe se emra no beja wo saa se ne nam ho ne de akone aba da bi wo so ye akon be so mu no emra no ene ubedi pa na omampanyi ensa kasai ene wo so nim se COVID-19 virus ebie niema so pa edin sama bawo hwe ame ye hu se yekoya pomudin dwumadi mu a entokrontokro bam 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 ededa ho na de wo kan me akosie ene se nank ye nim se eja ema bebre na ne kwa wo so a omomma ye hwe ho enkoda pinsu ye wo ma wo mti nananom e won se do eno so ye ni wo so a na chese ye den dan kakra enkoda wo munya nuane pani a eno so e ma wo mo hwe wo mo kwa ene eniema kai bi de na pomudin panyifo no wo mani si so papa na covid idea sembebe na amia be hu se nipa duba akọ omati nananom wonse do no se akomam nyarewa heart diseases ka ho bi papa obi a wo wuye bia obekom no na o akomam yare obi a wo wuye bia bekom na o diabetes esiche yare obi o wuye bia bekom na o asthma enti eno so amapomudin panyufo na be hu se se ye wasam bone po yeyi emma wo mkwa wo so omuwuo enkoda wo yare wo muwuo ene ade ne to nchen a akomam yare afa diabetes esiche yare ene asthma no se eno so yade a ehia na wo se apomudin panyufo emma wani eku ho pa enti wose efiti na ekoi e wose putupru so emergency service no eye adwuma pa wose anu nti na ambulances bebrei boy na samo hwe so eye COVID-19 breyam so drones no eye adwuma papa sa wemhye nkumankuma small boys and girls na omutumi ni na mwiem di nro ni ade boa papa wose sa abre ye de ye adwuma pa ni nyina ka emergency services no ehom na omampanyi san kasa no say sa covid kroya nso me be hu se ebre bia ye de ani hwe adoctafo no edo mani hwe aresabia kese wo enkura kese mu ni eja wo momwo enkwase ne mensi emo no na covid ya me abehu se wonyi twinyi adoa onso panyi onso akoda ebetumi atra akoba bia wo mai emo enti we na hwehwemu obetodwa ekyese ye wo mensi makomako aduotwe nwotwe 88 districts wo memu a sa district ana mensi no komu a mensi ayaresabia ba akokora ebi ni ho ene wo mantam makomako ensia enso wo memu a ye ni mantam ayaresabia regional hospital so ewo mo na chese ya ade a eha adwen pa eno no mampanyi ekase sabre ye hu se ho nso ye tosini e wo se ye meyeni ekoho na covid-19 therefore insunti no ya be hu se Ghana ye ni testing any isolation centers bebre ewo maimu a eto de eden a ye betima kase wenkwa ye ni bebre kakra bi na ye wo enti aban na siginan se fitin na ekode na ni abre o odi sika ebewura omai ya pomoden ebo
na omampani to aso e de etu eja awoche se mesini ahodrobe de wotwe e wotwe 88 de ne wo mu eni aresabia erinti obehwe na SCB ohom na ye hyase asante mantemu wo mu ebenya edu afesu so framantemu ebenya enkono 9 afesu efinfi mantemu esu benya enkono afe epoye mantemu su benya enwotwe greater Accra ha benya enso 7 afi upper east subenya enson na afi atifidu benya enum oko oti region so amuso ebenya enum 5 ewo ho upper west so ebenya 5 na abuno enso ebenya 4 no western of na afi so western of benya 4 na afi so to aso a western ankasa so ebenya 4 ɛna afei so mmiɛnsa so ɛwɔ ahafo mmiɛnsa ɛwɔ savannah mmienu ɛwɔ bono east ɛna afei so mmienu ɛso ɛwɔ north east region ne nyinaa mu ɛna wɔkyɛ sɛ weinom ɛyɛ sɛ ebi ebesi a ɛsɛ bi ɛbrɛbrɛ bi a otim sɛ ɛsɛ bi esi hɔ no ma tim sɛ yes ɔtramɔde papa baabi a dɔkotafoɔ ɛne anɛsefo wɔn de wɔn ti ɛbɛtoɔ ne nyinaa no ɔbɛyɛ ɛde ama wɔn ahwɛ anim sɛ afi mu anom wɔn apɛde kyerɛ papa ebe ne nyinaa ntɛntɛm ɛso so ɛde amana ahyɛ aseɛ ɛnso so ayɛ adwuma wɔsa atoa so ɛde ɛto dwa a wɔkyɛ sɛ sese so no emantam awodo be nsia eno so e ba be hyaseɛ wɔn so e ba nya aresabia kama pa eno so e be yɛ adwuma de aboa afei wodi wani kyerɛ ɛyɛ Ethian Kwanta Hospital enso so eno ɛwɔ secondia wo kyerɛ mu a e ba be hyaseɛ wɔn so no ye be nsiesie adwuma pa sanse 2x4 aresabia ne so no de etimi nyomanfo nkwa yebe to ebo asia yare sabia no kama adu abeka so wa abrochiri yebe no fefe pa enso so ewo ho afei so lab ahodo no sesi ebe ye ni kama pa na afei so 30 centers no yebe abesi bi enso so ede aka ho we no na wo cheche mu se Coastal Middle Belt na Northern no wo mo na sesi ebe gina wo mo eso no so yeba behwe na eno so adwuma na mo so de beba no na yede aba ewo apomden ekwan so afei wo sa ede atu edwa a wo che se yare a ye fe ne se CSM no eno so yare bia ehu ye pa mu se COVID-19 na ba CSM no so yare a so okon na so okon achi ni ade bo ho ana na wo sene no eno so ehu ye se de eno so dipa be aduanan wɔn so ahwere wɔn nkwa ɛno ɛna wɔkyerɛ mu sɛ wei ɛyɛ bra so yɛ nyinaa mia yɛ ntoma mu na sɛ mia yɛ ho yie pa na etimi boa na ɛkon no yɛsɔ ɛwɔ ɛso na etimi ɛhwe ɛho yie na ɛno so etimi ɛma yɛ ho ɛtɔ yɛm ɔtɔ so ɛde tudwa wɔkyerɛ sɛ healthcare system no ɛno so n'ani abere pa sɛ de ogu so a wɔka na no ɛnya deɛ bɛfa ɛnoma easy kra ɛno nti ɛno so n'ani abere a wɔde sika ɛso ɛbɛhyɛ mu biem na etimi aboa eno na watch say development authorities no say eye zungo fund no eno so ewo ho MMDCs there eno so ewo munyina no pani say wo de wo hye wo mo eye nhye wo taxi wo mo say munyina mo na so na de mo so ebeye na de mo nim ya mo dwumadi ahodo a mo ye bia no mo ye a mo fa apomudin de no emfa emra nimu eno ehia pa san say wo apomudin a ene da ka no betimi aye eno nti wo pani so wo hye wo mo pa say eno so wo mo ende ne ntem afis investment na de wo mo eye nyina no mo ema emu enna ho pa nya afi na mbe yeye kata so emu mu aso bia enso so ewo ho omapani esa eto aso ede tudwa a wo kire se enufra efo so omo a pharmacy for no sese omapani eni abre eno so ebehemu kina papa sanse da bia amagana na kubo twidampo ama yadwene ama nyansa a yebetimi ede ayadwuma na enso da bia efiri a ye kokosi broni ema so obroni kwa da nya dumre ne yenom wa abere esu kroma ye wo pharmacy for and pharmacist for akese e wo ha wo so ebetimi aye enu enso ede aboaye iti foreign na mano ne de bebire no ebe aka ye teso kra ne sa ama yankasa so ya ye de ama no so abo na o che se eni achi National Health Insurance Scheme say no ene be omu gina o Ghana no omu gina yie se insurance ni koyie papa eti we nyina no omu betimi aboa se de be ya ebema eye yapom den so no ebetimi agina na so ye ewo oman Ghana mu be akra no na Ghana yeso so no ye bo adwuma ema yapom den no bibia etu empom eno chese Ghana adehye so mmeka ya na ekristofo Yesu wu ye no omantimi ankokra ankwakusu ye na se ene ade no ma anko sanse COVID-19 aba una hwe na akusu Yesu enya ade ebefa eti Easter ne se no etimi amaso sabepepe ena ebrewe mu so no na muslimifo omo so Ramadan no so edu so na enam se de kristofo de no eno so virus ya affecting kakran sabepepe ena muslimifo de no so no eno so etie nana
yo yeguswa etra ensema omampanyi ede tu dwa no eso na baby akwabenadu ye ne ho na metwa so ede afi omampanyi ka sa mpa kristofo sa abre ne yentumi ani Easter na chese ye hyehyehye yen dem hesan say ban anase eso a ode ato nipa dodo enhyiamudie so no eda so a na eye adwuma enti yentumi empie di a eni ensu se de ensuo ye nsa ena wian so beye sabre yenuanu muslimi fo nso ahye Ramadan akomche no ase ena omampanyi eka se nkomsheni kunku Muhammad ogitum se ofinyankopon anase ala kasankasa enchen na wohwema na ebre bia ensuo beto no nkomsheni kunku Muhammad ede afutuo ene kokobo emma yenuanu muslimi fo nyina se ensuo to a obia nse ne fie na onsori nyame ana onsum nyame ewo ne kokoam emmo payo emane nye yie saa kwankyere na nkomsheni kunku Muhammad ede ma yenuanu muslimi fo ebre bia ensuo beto no na wo mudi so na wo mudi so mane yie pa eno so mo nso gitum se ampa enkomhyeni kunku Muhammad ofi alaho chodo a chese chinye bia enim enti omampanyi se enkomhyeni kunku Muhammad ofi alaho chodo dia ene ebrei emuda so a eden enti woje afutuo edifi enyansafo bi ti se National Chief Imam Sheikh Dr. Osman Nuhu Shaibutu enchen se opanyi dia bani o wadaroma yanya ne den ene wo se oni Sheikh efa adwen no ono nso atunufo agye atum se ampa ebre nya brepa enti yennuanum nkremofo Ramadan akom chinenum no wosre monkoso a enhye mofiefie ene modem ene mokokoam na momfre nyame ema no enye yie na bebia bebo mpa ye bia no ala bete na wadi ede ama omeye eno no ogina so se yennuanum muslimufo nyina Ramadan papa Ramadan Mubarak Ramadan na ede enkwatenten ene enkoso ebeba na ebre mu die omampanyin se virus no eno ani minu mienu nyina yetamfo yankasa de yentan ye ho odo wo yentamo pa enso yetamfo ba kwa yenya e wo memu e virus no enti yema yeni enna ho na ensihye bia mpanyefo edi gu akwan so se de be ya virus ne yebetumi etusu sa na ya brenase no yenuan muslimifo nyina enhwe se yebetumi edi so na awieye no obonse sa otamfo ba kwa eye COVID-19 virus no yebetumi edi no so enkunem omampanyin se onam no onim oman a COVID-19 yakodu so na efefe nese edi chiro manfo na nyaminie me ne COVID-19 me de mabede mo oman we de me pemo asempa enti me nkamo made hye we de me fa me sanka da bi o se onhu bi ba bi a COVID bedu bia no se ya de ba bi obedu bia wodi hu ba wodi hu eka eni ayamhyehyie ni ewuo na eba wo se ya de papa enti ebrei enye brepa Ghana for montai na chi na yemfa hyehyɛ no enye adwuma na nanu muslimifo mu ni hyehyɛ no eso na nkakran o gidie se ye de ye adwuma yensi kasema ebubuo no ye betumi hwe na yakrakra
na metwa so a omapani ede eto edwabio a wo chese eye na ahoahoa ene ahosepe na utimi echeste out ka se me omapani ampa mesum me manfom na wo chese ebra mu edisi no wo hwe se de omafo esi eboa na papa na no mokra na obo eye foto editu wo eye COVID-19 trust fund ne to wo na okra na o hwe news ni ade na se de nkofo se bi sika de ba amafo donation was wow Ghana for fekeke mampani se ebre mu odin se yem na nkofo ate ase na ye boa no papa osato aso editu ya a wo chese sa breku ye mu no wo hwe se de Ghana for bi esi enya omo ho ente ase na ye nyatima ede ama ye ho a na akono na enika so se yetimi edodo ye ho wa bra emu edini se ye yenkoso a na eno so entimi emwa ye sa wo bra emu edi mom ase no eno mapani research pa enso so ewo ho na wo chese nuano munim se dia ba ye die den emu ya pa na so nyina mu o arehemu se onyankropon twedi ampon basa ye dom na dawro ma enti no se de waka ne nyina no ye diso na ye ne kama ebetimi aboye ye wohoro yensa ye diti yentamum ye hye max wa abre ye pia abonten na ye ma chese ahunidie akoso no ni na no ebe kama na eno so aboye na ogidi se onyame ebe boye emasa eye ebre wo ye eye ebra emu eden no yenso ye betimi afrimu na ye ma na ase no omampani eka eye enkran kasa na enom so de aibe kakra enso ede toso eti enche emse yetu ensa ede afra abafra dicti na enkran ni mu no ono akasa ede abreye na enwanu ma before so omo
so beboaye
enwanu prezo bimpe omo so beboaye
ni Mustafa mo ndi akọ
ye dimi anka no enkran ena igbenu mu abusia eno aha ni abo ni twidi tofa de amamu no omampani si brewe no emu adem na ogide se yakobo twida fo betima aboaye eti ye ni eno ma hodo ni hye ye nyina so asem ni titi ya hori yensa na ye pia ye no sumas ni ebi ye tete ye ntemon sanitizer no edi so kama eno no mampanyi chese onyame enhira ye nyina na onhira oman kronkron Ghana na afei oma eye oman Ghana enso so enyira ne na so eyi na ima na entuma ye mampanyi ehye ya odin sem ne ede breye no ye frɛ no afibi sign.
Afibi a sign pa. 2020
na adumako nyameche enyom afibi a sign. Eti na ima wadaro ma.
Kwabena esi hanu so bio. Omampanyin say Ghana for pamo chew. mommoa me na wakwa me ra ho mommoa me na mintumi nye majuma ajuma na den enti osre wo se yemmoa no enti utifie a esre obo mampanyi wai so what do betima yeda da
say no ya kan no smiles sanitizers ni bibia and after so ya ka o for say 2 weeks no mampanyi dia ka ho bio social gathering no en sorry ye hyehyɛ ma yie sa no ma ni nyina no itimi enye na otwi bienum bam and also the account edamaye that's the PSC anadwi the ma a production team no papa Father Dixon Doc after so senior Prince Obimpe Isaac Owusu Buama Mustafa Rasta Mark and ebusuafo nyina mo eboaye ma anadwi team e de o mapeni asemode tudwane chemu e de ebrem Anahima Obahima Fiachere Esidu of Mame Ebekame ho and Covenant Wusiako Okabrane and so Moti and Kenti. We may Aduma Ochina Ebazeshia Edamasi.